Firstly, I want to acknowledge the incredibly challenging time many of you have experienced as a result of the COVID-19 pandemic. The change in routine for you, the reduced level of socialization, and in some cases, complete isolation from others must be very hard for you. I also want to let you know that we are taking every measure we can to ensure your safety and that of our staff while meeting your needs. We have been strictly following advice from the Department of Health, which has informed our COVID-19 prevention and management procedures. This includes strict screening of our frontline staff every morning. As I have mentioned in previous communications to you, staff are only allowed to work if they are well and pass our very strict daily screening procedures. Staff must not see clients if they are experiencing any cold or flu-like symptoms, or if they have come into contact with anyone who has tested positive for COVID-19. We assure you that we are very clear on this and have reiterated to all staff the importance of adhering to these procedures and the serious consequences of not complying. We are also asking our staff to practice social distancing and keep any time that must be spent in confined spaces with clients to a minimum. Anglicare at Home frontline staff have also completed a range of specific COVID-19 training programs to ensure that they understand how to stop the spread of the COVID-19 virus through effective hand washing and other infection control practices. Now, I want to say a few words about Newmarch House. We are deeply saddened by the outbreak at Newmarch House, and in response to this outbreak, Anglicare is doing all it can to prevent further spreads of the virus with the support of New South Wales Health and the Commonwealth Government. This includes ensuring that the frontline staff who work at any residential aged care home with an outbreak do not also service our clients in their homes. As of the 24th of April, the New South Wales Government is encouraging certain aged care staff to come forward for testing. These staff are those with any respiratory symptoms or unexplained fever, or who live in COVID-19 hotspots. We have communicated this to all our staff members. And as a further measure to protect our clients, Anglicare is providing all staff with the opportunity to receive a free seasonal flu vaccination before the 1st of May. And I have strongly encouraged all frontline staff to take up this opportunity. While the flu vaccination does not prevent COVID-19, the flu shot is critical in protecting the health of members of our senior community who are most at risk of contracting influenza. Finally, I would like to reiterate that we are still able to provide the essential services that you rely on. I wrote to you in early April to let you know that we have adjusted our services and will only carry out essential services at this time to minimize the face-to-face contact. But what is deemed an essential service? If you or someone you're living with is unable to carry out a task due to health or safety reasons, then that service is deemed essential for you. For example, if you're unable to clean your house yourself due to health reasons and you don't have anyone else, such as a family member, to help you, then cleaning is deemed essential for you. You may have a sore back or arthritis that prevents you from carrying out the cleaning. We can still help you with that if needed. And this can be applied to all other services. If there is something that must be done and you are unable to carry it out for yourself, we are here for you. And we don't want you putting your health and safety at risk by forgoing services unnecessarily. I want to reassure you that we will continue to provide the highest quality support and strictly follow advice from the Department of Health to ensure your health and safety. We are still carrying out thousands of services on a weekly basis, and I'm pleased to be able to say that thousands of Anglicare at Home clients are still benefiting from our services and care during this time.